Hi, I'm Mustafa. I'll be your nurse today. We're just going to conduct a head-to-toe assessment. So I'm going to ask you a couple different questions, and I would like you to answer to the best of your ability. First, just starting off, can you tell me where we are and what your name is?
My name's Haley,
And where are we?
and I'm Dr. Thomas,
Okay. And what is the year?
2020.
Okay. I would like to ask you, can you just show me how you walk? I would like to just kind of take a look at the way you walk. Like if you just walk that way and then back. Okay, and can you stand right there and put your feet together? Okay, and so this would be like a Romberg test. So I'm testing her balance and her coordination. For the purpose of this exam, I'm not going to do the full 30 seconds, but typically it would be 30 seconds. You can take a seat. So we're going to start off at the head. I'm just going to do kind of an inspection, just looking with my eyes and seeing that she has good hair distribution. There's not any patchiness or anything. The texture of her hair is about normal for her age and ethnicity. Just looking at her eyes and the facial features, she has good distribution in the eyebrows. Nothing abnormal on the face. We're not looking at any acne or any kind of lesion going on. So just just looking around, taking like a kind of like just an inspection. Um, okay, now can you look at my finger? I'd like you to follow my finger, so I'm going to move it in a couple different shapes. You just follow my finger. Okay, and this is a test that is commonly used to check some cranial nerves, including abducens, which is the one that when we go like this. So that's one of them. While we're up at the head, we're just going to do a little bit of palpation. So if you don't mind, I'm just going to touch different parts of your face. So I am going to just kind of get a feel for this and see if there's anything abnormal. I'm not feeling like any lumps or anything. While we're up here also, if I had an otoscope, which I don't unfortunately, but using the instrument, I can take a look into her ears and look for any abnormalities, maybe any redness, drainage, any signs of perhaps an infection or some other sort of lesion that's developing in there. Seeing as though she's able to follow with her eyes, I would say that that's an area that is mostly covered at this point. Um, also, if you can just, can you turn your head from side to side like you're saying no? Okay, and then can you go up and down? Okay, and then I want you to touch your shoulder with your ear on both sides, like that. Yep. Okay, excellent. So while I'm up here, I'm also going to assess for lymph nodes. There's a few different lymph nodes. We've got some over here. We've got some on the chin, underneath the mandible. They go all through here. And I'm not feeling any enlargement of the lymph nodes at this point. That would be an indicator of lymph buildup and possibly some kind of infection that's located in this area. So I've tested some range of motion with her moving her head around and just going side to side, and she has complete ease with that and is active range of motion. She's able to do that even with some resistance, and it is not passive at all. So moving on from that, I'm looking at her eyelids, and I don't see any kind of facial droop or any sort of ptosis or any drainage or anything. At this point, we can also we can look at the conjunctiva. So if you could remove your glasses for just a second. I'm just going to look under your eyelids. Okay, so I'd be looking down here, and I don't see any redness or inflammation, and I don't see anything up there either. So that's one way that we can check for something like conjunctivitis or any drainage that may require her to see a physician about that. So just thinking of what is next. Okay, so while I'm up here, I'm also going to check some of the arteries that she has. So up here, we've got the temporal artery, and I can feel a good pulse over there. Yep, and just going to make sure that I can get that pulse, and I'm feeling a good pulse over there. If you can just lean back against the sofa for a second, I'm gonna just check your neck really quick for your jugular veins. And at this point, I don't see any jugular vein distension, which could potentially be a complication of heart failure or symptoms of fluid overload in some patients. So I don't see any of that, and you can lean back forward. So I've checked for the lymph nodes, I've checked the JVD. At this point, I'm going to take a look at the other arteries up here, which would be the carotid arteries. So being careful not to occlude either side at the same time, I'm going to do one at a time. So I'm going to check this one, and I can feel a nice strong pulse there, and on the other side. And I also feel one. While I'm up here, because there can be stenosis and narrowing of these arteries, I'm definitely going to take a listen here with the stethoscope to hear the characteristics of the syndrome. Okay, that sounds about normal. There's no rushing sensation, no high-pitched noise. Okay. And moving on from the head and neck, I'm going to do an assessment of the chest and the back and the abdomen. So I'm going to start here by looking at just the overall appearance of the torso. There's symmetry. It doesn't seem like one side is larger than the other. If you could just hold out your arms for a second. I'm looking at her arms. A little bit of asymmetry in the length is normal, but there is nothing abnormal here. Everything appears to be symmetrical. I'm noticing at this point, with the patient in the hospital, you can put your arms out if you'd like. I would be looking for, a full head-to-toe skin assessment, which would involve the removal of the garments. I'm looking at her skin for any potential lesions, open areas, ulcers, etc. I'm only seeing a little bit of freckles, which for her ethnicity and her genetics is normal. Nothing about her skin at this point looks like anything that is pathological. So I'm looking at that. The other thing I'm going to look at is if you can take a couple deep breaths for me. Actually, if you could turn that way, that'd be great. And I'm going to do I'm going to assess for chest expansion. So I'm going to look at when she takes a deep breath, both sides of her lungs should expand equally. So I'm going to go ahead and do that right now. And I'll be putting my hands right over here. Just take a couple deep breaths for me. And I can feel both sides expanding equally. Yep, okay, thank you. And while we're also doing that, there's a similar assessment. Actually, if you could turn back over really quick, we can assess for CBA tenderness. So I would take my hand and just kind of like that, and she didn't react. So that would potentially be an issue if she did react in pain to that. But did you feel any pain when I did that? Okay. Okay. So she reports she didn't feel any pain. So we're going to move on to. I am going to take a listen here. We're going to start with the lower lobes in the back. So you take a couple deep breaths for me, please. Okay. And can you say the word 99 after you exhale?
99.
Again?
99.
Again?
99.
Again?
99.
Again?
99.
Again?
99.
Okay. And you can take a breather. I'm going to give her a little bit of a break before I move on to the front lobes. So when we ask her for, to say the word 99, we're assessing for fremitus, and any potential, vibration in the chest can give us an idea of what's going on in there. Giving her a little bit of a break, we can start with a little bit of percussion in the back while we're also in that area. So I'm just going to go into the various different lobes and do a little bit of percussion. And all these areas sound resonant to me. So moving on from that, we're going to go ahead and do the front now. So if you could lean back a little bit. Thank you. You're just gonna do the same thing every time I move it. After you exhale, say the word 99.
99. 99.
Okay, and one more time.
99.
Okay, and while I'm here, I'm also just going to get an apical pulse and get an understanding of the cardiac situation. So I'm getting a regular pulse here. At this point, I can do a more extensive cardiac assessment, just listening to the different areas. So I would start here at the, to the left of the sternum, and I'm going to follow the ape to man method. And you can just breathe normally. And doing this, I'm not hearing any kind of murmur in any area, any kind of gallop or anything. It's just an S2, S1 or an S2. So moving on from that, I'm going to, while I've got here, there's certain tests that don't necessarily apply to the head or the thorax or anything. So I'm just going to continue to do those at any point. So I'm going to give you a couple tasks. So one thing I'll ask you to do is, can you count backwards by sevens from the number 100? And I will tell you when to stop. I know I'm kind of putting you on the spot.
Got it.
And I just do that. I'm listening. I'm just grabbing something.
93.
Okay.
85. 86. 79.
For this patient, I am confident that her ability to, so when we do that, we're testing for her ability to pay attention, essentially, to focus on a task and the concentration. So judging by that and the rest of the assessment thus far, I can tell that she's able to pay attention to a reasonable and appropriate degree for a healthy individual. Okay, so I'd like you to close your eyes. I'm going to put a couple objects into your hand, and I want you to tell me what they are. And beware, because one of them is a little sharp. So I didn't think that through. Here you go.
Okay.
That's a pen, yep. And then this one.
Okay.
Yes. This one, be careful.
Safety pen.
That's right. Okay, and keep your eyes closed. I am going to draw a shape onto your hand, and I want you to tell me what that shape or symbol is.
An A.
Okay?
An X.
Okay, so this is part of a neuro assessment. She's been able to answer these questions appropriately. So moving on from that, I'm just going to kind of continue the thoracic assessment now that she's had a little bit of a break, to have a little bit of a breather after asking her to breathe heavy for a while. So I'm going to do a little bit of combination of arteries and some muscle tests. So because I don't have a reflex hammer, I'm going to demonstrate at what areas we're going to do the reflex tests and the expected appropriate response for somebody with like a baseline finding. So I'm just gonna. So I would be getting a brachial pulse over here on the internal aspect of the upper arm. Okay, and I'm getting a 2+ pulse there, and then I'm gonna get the radial pulse here. Okay, and I'm getting bilateral radial pulses at 2+. Okay, and I would be taking a reflex hammer with the bicep with the bicep completely extended and limp, and we'd be taking the reflex hammer and going right here, and then right here, and expecting an involuntary response. So with somebody in this healthy condition, without any electrolyte imbalances or anything like that, or potential nerve issues, we can expect that she would have, a typical quick jerk reaction. So, okay, so moving on from that, we are going to do, I'm going to take a look at her arms while I got her here. So we've already looked at the symmetry and the, assess the skin for any, potential issues on the skin. So we're going to look at the hands themselves. If you can hold out your hands, please. So I'm just looking here. She does have painted nails. I'm going to be looking for potentially any issues underneath the fingernails, any issues with the fingernails themselves. Do we have any clubbing, any spooned fingernails? So I'm just going to get a capillary refill on all of them, and I am able to see a less than 2-second response from this capillary refill, and this is just assessing for circulation in the extremities and oxygenation and perfusion as a result of that. So, and I've seen that she has an ability to completely contract those muscles, so the musculature and the nerves in that area are adequate. So moving on from that, I already asked her to, I put different items in her hand, and that's part of the neuro exam to understand where, does she know what object is being put into her hand. I'm going to ask another neuro-related question. So this might be an odd question, but I'm wondering, can you tell me what the difference is between a peanut and a country? Yep. I know it's a weird question, but if you just, a peanut and a country. What, okay, can you tell me the difference between a turtle and a washing machine?
One slow, one washes.
Okay, so the purpose of this exam is we are trying to assess abstract thinking. So in a patient who is unable to differentiate, the response would be either no response. The patient would not be able to tell me that there is indeed a difference between two things that are essentially unrelated. So this is, there can be a barrier where the patient doesn't understand what the purpose of the exam is. But in this patient, we, through other assessments, and including this one, we've been able to assess that cognitively she can understand abstract thinking. Also considering that she doesn't have any past medical conditions that would indicate that she does not understand those things, I'm comfortable with the response that I've received. So moving on from that, I'm going to ask her to continue along with a little bit of the neuro. If you can you put your fingers to your nose? Close your eyes actually, and then hold your hands out to your sides like this, and then hold one arm in place, and then with the other one, put your finger to your nose and back. Okay, and then again. Okay, awesome. And you can open your eyes. And okay. Now, can you take? I want you to take your heel and then touch your opposite shin with it, and then bring it up your shin and then down your shin like this. Okay, and then the other side. Okay, and this is an important neuro exam in which we can understand her ability to coordinate, especially in somebody who may have a potential impairment, a one-sided impairment. This would be an excellent exam to do because not only does it give us an idea of coordination, but it also gives us an idea of symmetry. So I've been able to assess her coordination at this point. So now we're going to move on to the abdomen. So I'm just going to listen to, we're going to start off with an inspection, and obviously, this is a portion of the exam that would typically be done with removing the clothing. And we're going to look at the skin. We're going to look at any abnormalities, any lesions, any potentially surgical incisions, open areas, anything like that we're looking for, and we're going to document and understand if that's maybe a new thing or this is a past thing that has happened. So that's going to be kind of my inspection phase. In a lot of people, you will see maybe discoloration. In pregnant individuals, you might have a little bit of discoloration around this area. You can have striae. There's a lot of different things. But in this individual, we don't have any of that here. So we're going to start with the inspection, of course, because that's the least invasive. And with the abdomen, if you do begin with palpation or percussion, you may have a false reading, because if you palpate and then you start to listen, then you're going to have, you might have what sounds like hyperactive bowel sounds that are really just the result of you essentially moving the contents of the bowel around inadvertently through the palpation. So we're going to begin with the inspection, and we're going to start with the auscultation. So I've done the inspection. We're going to listen to all 4 quadrants. And you can just breathe normally. Don't worry about it. So I'm going to start with the right lower. Okay, and I'm getting a couple different sounds every second, which tells me this is normal to hyperactive. Okay, and after the auscultation, we're going to start with a little bit of percussion. And we're going to do the percussion first because it's not as powerful as the palpation. So with the percussion, we are going to percuss the different quadrants, and then we're going to percuss the liver span right underneath under the rib cage, and this will give us an idea of any hepatomegaly or possibly splenomegaly if we have that. So I'm just gonna, if you can lean back a little bit, I will just kind of do a little trick over here. Okay, and all the areas are resonant. I'm going to go under the liver span. Okay, and with the liver span, we're going to be looking for something between 6 to 12 inches, and that's what I'm getting here. I don't sense that, with the sounds that I'm getting, that there's any dullness, any particular change in the quadrants of the abdomen. It's resonant to tympanic. So moving on from that, we're going to do a little bit of light palpation. So I'm just going to put my hands a little bit on your abdomen, and we're going to go light and then a little bit deeper. So you tell me if any of this is causing you pain. And this is a way that we can essentially do a pain assessment and also an abdominal assessment at the same time. So doing this, I'm not getting anything. I can feel the different viscera, but no masses or anything here. Okay, and after doing a little bit of deep palpation, she's not feeling any pain. So I'm going to go ahead and listen to the abdominal aorta and the renal arteries while I'm here. Okay. And when you're listening to these, especially with the abdominal aorta, and the tendency of aneurysm to happen in those areas, we want to be listening for a whooshing sound that's similar to a what do you call it? A murmur. But we're not hearing that here, which could potentially be a sign of an aneurysm if that sound is present. But we're not hearing that. So we've done the auscultation, the palpation, all of that. We've done the CVA tenderness. So now we're going to look for kind of like we're going to go back to just kind of the whole body assessment of strength. So I'm going to ask you to do a couple different movements, and this is going to give us an idea of a more in-depth idea of the musculoskeletal system and innervation as well. So if you can hold your hands out like this, I'm going to tug on your hands. I want you to resist it, okay? Okay, and then the other way. Okay, and I'm going to do the same thing with your feet. Okay, and then the other way. Okay, and I want you to push out with your knees against my hands. Okay, and then push in. Okay, now I want you to do this back up here. We're going to push inwards. Okay, and then push outwards. Okay, I'm gonna have my hand here. I want you to push against it with your head. Okay, and then the other way. Okay, and so what we're testing for here is essentially not just her range of motion, but also her strength and her ability to resist against external forces. So what I'm getting from here is that the musculoskeletal system is well developed and adequate for somebody of her age, and you know, there's no evident deterioration on inspection. We don't have a cachetic appearance or anything like that. There's not you know, like a overly large amount of adipose or anything like that. Just very you know, to be expected in this area. So we've tested range of motion. I'm going to do a little bit more in depth on range of motion just for the purpose of this assessment. So what I'll ask you to do is if you can put your arm out like this, and I would like you to rotate it in a circle. Okay, and then do it again with the other hand. Okay, and I've seen her walk, which is also, I'm checking for her gait, but I'm also doubling. That's going to be checking for her balance and also for her strength in those extremities. If I were to see any sort of gait abnormality there, then we can do a more focused assessment and potentially call in physical therapy or another specialist that's able to provide more insight on, you know, what could be causing that. Similarly, there can be things like medications, you know, anything vital sign related, maybe a drop in blood pressure, orthostatic. You know, perhaps she has a wound or a lesion on her feet that is causing her to favor one side more. You know, in patients that are high risk for stroke, this is something that we're going to look for, especially with the unilateral weakness. So I'm not seeing any of that. I'm going to ask her a couple questions simply to get her to talk so that I can assess, you know, certain things like developmental stage, vocabulary, basically to kind of assess whether her cognition is in a normal place for somebody of her age and situation. So can you tell me, what have you been doing at work lately?
I usually just walk and bend and pick up things.
Okay. And can you tell me, what did you do 1 year ago for your birthday?
I sat at home.
Okay. So both of these assessments are assessing for both long-term memory. I'm asking her for something that happened a year ago, specifically because I want to know if her long-term memory is intact and it's not just short-term. I'm also asking her if she can tell me what she's doing at work, so that to assess whether or not she has the conversational skill, you know, or the vocabulary to communicate what she needs to communicate. This also gives me an idea of her developmental stage, because some individuals may lag behind in certain areas where either they're not able to communicate these things, or perhaps you know, their life circumstances are different. These are important things for a registered nurse to know because it helps us to kind of cater our care and our care plans around that individual's needs and how we can help them advance best in their life for their circumstances. So this serves as not only an assessment, you know, neurologically, but also for the nurse ourselves, where we can kind of, like I said, you know, figure out how to cater our care plans accordingly. So. So just looking at that, you know, after I complete the bulk of the assessment, you know, so I've gone head to toe. I've looked at her hair, I've looked at her face, her skin, different areas. I've looked at her eyes, the nose, the mouth. I've looked at her neck, the different arteries, the circulation. Done some neuro exams, both for cognition, for memory, and actual sensorimotor assessments such as the Romberg or having her walk up and down. I have asked her to move both passively and against resistance, and taken the results of those. I have, you know, I've assessed a couple cranial nerves, including, you know, follow my finger, for example. That's one of them. As far as gag reflex goes, this is something that I would use a tongue depressor for. I would ask her to open her mouth, insert the tongue depressor. Similarly, this can also be done where I can, you know, I can look inside, and I'll demonstrate this, but I don't have a tongue depressor, but I will demonstrate, and just kind of narrate on how it would go. If you could open your mouth for me. So one thing I can ask her to do is to say ah. Can you say ah? So when she says ah, the tonsils are going to move up, ideally. And when I'm looking at her, this is what happens. This is also a good way to assess dentition. Maybe she has some missing teeth or anything like that going on. She might have some kind of something going on with her tongue, any lesions on her tongue, perhaps thrush, from taking steroids or anything like that. Nothing like that is present. This can also be a way to assess for the use of illicit drugs. It's definitely a multifactorial assessment. So I'm looking at that. I would insert the tongue depressor. I would definitely try it on one side. That way it's not completely occluding both her airway and the digestive tract, so that in case something does happen, it's not completely invasive in that way and impairs her safety. So thank you. And so moving on, so I've gone from the head, all the way down to the neck. I looked at her. I looked at her neck. She doesn't have an enlarged thyroid, or there's not any lymph node enlargement, no tenderness when I'm touching those areas, with her lymph nodes, which could be an indicator of localized infection. Great tool for understanding where the infection may lie. Looked at her ears. Don't have an otoscope, but if I did, I would be looking in there for any signs of abnormalities in that tissue, and potentially any drainage that would also be indicative of of further infection. Maybe there's excess cerumen, all kinds of things that could go wrong there. So all of that appears to be intact. Moving on from that area, we going to the thorax. Everything looks symmetrical. The skin itself is appropriate in terms of for age and ethnicity. There's no abnormalities, no open areas, no lesions. Did note that she did have a little bit of freckles, which she has told me that she was born with, and there's no other abnormalities in that area. So moving on from that, listen to her lungs in the front and the back, assess the fremitus and the bronchophony, and there's no abnormality there. Did a little bit of percussion. All areas are resonant. We've done that. We already tested the gag reflex. So just moving on from there, we go to the abdomen and listen to all the areas first. Sorry, we inspect all the areas first, looking at the skin. Then we're going to look for any potential masses, pulsations, any serious abnormalities that could stick out and be imminent issues. We don't see anything there. So moving on, we've done the auscultation. On the auscultation, there wasn't anything other than normal to hyperactive sounds. Did a little bit of percussion, percussed the liver span, which is between 6 and 12 inches, and there's no enlargement that is apparently present on inspection. Moving on from the percussion, we've done the palpation, and both the deep and light palpation, there wasn't any feeling of pain that she had reported in that area after I instructed her to do so. So we did the CVA tenderness in the back, and there was no CVA tenderness. Finally, we wrapped up with the strength in all the extremities. We've been doing the neuro, kind of like going through the different areas as we proceed throughout the assessment, and nothing was abnormal there. So with that being said, I'd like to finish my assessment with giving the patient the opportunity to ask me any questions as a clinician, or to express any needs or wants that she has during this time, both to establish rapport and establish foster a good relationship with the patient. So I would just like to ask you, to thank you for participating in the assessment and allowing me to do that. And if you have anything that you have to ask me, just let me know. And if there's anything that you need while I'm here.
I don't have any more questions.
Okay, so she doesn't have any questions. She doesn't have any needs at this point. I'm going to wrap up the assessment. I'm going to take note of everything that I've learned here and pass it on to the appropriate people. So, and that is the conclusion of this assessment. Thank you.